If you use SimplePractice as your EHR, you may have received an invitation recently. It's an offer to join Evernorth Behavioral Health Care's insurance network at what they were describing as premium rates. A select group of therapists got the invitation, and when I started pulling on that thread, it opened up something a lot bigger than one invitation from one platform. Hi, I'm Kristen. I'm a trauma therapist and a business coach for trauma therapists who are ready to evolve their practices. Today, I want to walk through what this SimplePractice and Evernorth partnership actually is, who the players are, and what I think it tells us about where our industry is headed. Because whether you take insurance or not, this is going to impact your business. So let me back up and tell you how I even found this. It was another social media post that sparked my curiosity, and it sent me down another rabbit hole. Someone had posted whether anyone had received this invitation through SimplePractice to join the Evernorth Behavioral Health Care network. So I talked to some colleagues who also have SimplePractice and confirmed that yes, this was something that was going out to some clinicians. If you watched my last video, I laid out a hypothesis about our industry. My initial hypothesis was that insurers are moving toward platform-based credentialing and will eventually stop credentialing independent providers directly. This week takes that hypothesis somewhere new and honestly, someplace a little bit uncertain. As far as I could find, there has been no official announcement from SimplePractice or Evernorth about this partnership. So if I refer to it as a strategic partnership or a partnership, just know that that's my language and not theirs. At first glance, you would think there are two players here, SimplePractice and Evernorth. But when I dug into SimplePractice's own FAQs, there was a third party that showed up, and that was Octave. So I want to quickly walk you through each of the players so we know who is who in this process. SimplePractice, you probably already know. It's a practice management tool and electronic healthcare record that a lot of therapists use every day. Evernorth Behavioral Health Care is a part of Cigna Group. And on their website, they describe themselves as a community of behavioral health clinicians grounded in the belief that high-quality behavioral health care is critical to whole person health. They're contracted with Cigna Healthcare and some other health plans. But basically, they operate independently, from what I can see, almost like a Headway and an Alma. Now, here's the third party, Octave. Octave also, like Headway and Alma, offers evidence-based therapy with outcome tracking, and therapists can partner with them as 1099 contractors, a W-2 employees, or through group practices. They're in a limited number of states right now. So we have SimplePractice, which is the EHR, Evernorth, which seems like the platform, and now Octave, which also seems like another platform. So that makes it a little confusing. But here's how they connect. Octave is the administration and operational kind of liaison between SimplePractice users and Evernorth. So if you are one of the selected clinicians and you accept the invitation, you would work with Octave to credential with Evernorth, and Octave would handle payment and the administrative details. And I believe this is connected to Octave's recent announcement, I believe it was in March, of launching a platform called WiseMatch, which they describe as a way to modernize insurance directories. So their pitch is that behavioral health networks are fragmented across independent providers, group practices, and disconnected EHR systems. So provider information gets outdated fast and patients can't find care. So WiseMatch integrates across those sources, including the EHRs, to give patients real-time availability and updated provider data. So what are they actually trying to do here? I think there's multiple things they're trying to accomplish. But let's talk about the first one that is genuinely a problem in our industry. In the past, it has been incredibly hard for clients to find providers or therapists who take their insurance. And I think we can all say as a therapist that we've lived this either personally when we've tried to find our own provider, or when potential clients reach out to us and tell us about all of the ways that they have been trying to find a therapist. They go through the insurance directory and they email or they call therapists on the list. And they find out, one, maybe that person doesn't even accept that insurance anymore. Two, the therapist has no openings. Or three, sometimes the therapist never even responds at all. So we understand the frustration. And I think the attempt to fix this is valid and absolutely necessary. It has been a problem in our industry for a long time. So this collaboration between SimplePractice, Evernorth, and Octave is designed to solve that problem. With SimplePractice connected to Evernorth through Octave, a potential client can see the therapist profiles, check their insurance status, see real availability, and book an appointment. It's low friction, and it's a reasonable timeline, and the client can actually get in for services. But here's the catch. They will only see clinicians who are on SimplePractice. And in a broader sense, that's how the other platforms like Headway and Alma and Rula and all of those work. The directory only shows you who's inside their system. And if you're not, well, you're going to be missing out on those referrals. So let's talk about the benefits to therapists, because I think there are some real ones that we need to note. The ease of connecting to potential clients and letting them book directly with you when you're actually available is a genuine plus. It means more of your time goes to client care and less goes to marketing and administrative back and forth. And connecting through the EHR you're probably already paying for cuts out a duplicate expense of paying for a Headway or an Alma or however that platform charges you. And that consolidation is worth considering. But what are the risks? Again, you're at the whim of the insurance company. But more importantly, you're at the whim of the insurance company's agreement with that platform. So in this case, you are at the whim of the agreement between SimplePractice, Octave, and Evernorth. If they change their agreement, then those rates change. And so when they put out offering premium rates, well, then they decide to change those rates. It's their contract they're changing, not yours with the insurance company. And it's just much easier for them to do. And that's why it's important just to acknowledge that these businesses are in the growth phase right now. And that is why these reimbursement rates look so attractive. But we have to keep in mind businesses evolve. And just because these firms are in a growth phase right now doesn't mean that they stay there. They will move out of growth phase and into being established businesses, which I talked about in my last video, and I'll link that below for you if you want to watch it. But I talked a little bit about VCs and growth phases, and then what happens next, mergers and acquisitions, initial public offerings. The most important thing to know is the focus moves from growth to profitability. And that's when therapists will start to feel the squeeze. And I'm not saying that to scare you. It's just how businesses evolve. And it's important to factor that into your business decisions. But there was something else in the FAQs and in that the way this partnership is structured that caught my attention and got me into another deep dive that I won't be able to cover all here. I'll cover it in another video. But here's what it is. In the FAQs for this agreement with SimplePractice and Evernorth, participating clinicians are expected to practice measurement-based care by reviewing outcome measures their clients complete during treatment. And that aligns directly with Octave's mission of therapy that's evidence-based and outcome-driven. Their language is that Octave therapists can measure a client's improvement as they progress to therapy graduation and change approaches if the client isn't seeing results. So let's talk about what this might mean. There is a consolidation happening in our industry around the idea that measurement-based care and evidence-based treatment are the most effective path for healing and wellness. And I know that is going to elicit a lot of opinions from therapists. And I just want you to know that right here, we're not about debating whether that's right or wrong. My focus in these videos is really on showing you what's happening in the industry so you can make wise decisions about your business. And the important point here is this is bigger than one partnership between SimplePractice and Evernorth. This month, in July of 2026, Medicare rolled out the Access model. And the Access stands for Advancing Chronic Care with Effective, Scalable Solutions. And when they're looking at chronic care conditions, they do include depression and anxiety as a chronic health condition. On the Medicare website, it states, Original Medicare will have a way to pay organizations developing technology-supported services. And I read that to mean the entryway into behavioral health services is going to run through a technology-enabled solution that they deem effective and scalable. And like I said, that deserves its own video and its own deep dive, and I am already working on it. So let's come back to my original hypothesis that I started with. I originally said that insurance companies are going to move from credentialing clinicians independently to only credentialing them through platforms. And based on this partnership, I'm still going to stand by that. But I'm going to add to it. It's not just the platforms now like Headway, Alma, Rula, Grow Therapy. We are now seeing EHRs move into this space. But I also have to add one more piece to that hypothesis. Measurement-based care and technology solutions are going to start reshaping insurance-based care. Now, here's the honest part. There are moments when I look at all of this and I feel like panicking or what are we going to do as therapists in private practice? But then I pause and I recenter myself and I come back to what my commitment is. And one, I'm committed to staying aware of what's changing in our industry. I'm committed to sharing it with you if it's helpful. I'm committed to staying focused on my private practice and my business, and most importantly, on my clients. And that's the same thing I'm going to invite you to do. Our industry is changing quickly, and it is going to impact your business whether you're in network with insurance or not. Staying informed is not the same as reacting to every headline. It's how we keep agency over our businesses. So here's what I'd invite you to do this week. If you received one of these SimplePractice invitations, don't accept it or reject it on impulse. Sit down and look at it as a business decision. What are the rates? What does measurement-based care require of you? And does this fit the practice you're actually building? And if you didn't get an invitation, it's still worth knowing that this is the direction things are moving. If this content is useful to you, the best thing you can do is subscribe to the channel. I'm going to keep tracking these changes and breaking them down as they happen, as I can keep up with them. So if you don't want to miss out, please click subscribe. Next time, I am going to dig into this Medicare access model and what technology-supported behavioral health could actually mean for us.